Hi, Ashley Francis here with Blue Sage Counseling and Wellness, the holistic psychotherapist here in Charlotte, North Carolina. So if you are following the videos in order, then that means that you just completed how to get started, and this video is an extension upon that one to talk about the assessment. And the assessment is what is completed during your first session. So I'd like to allocate 90 minutes to this session because there is a lot of information for us to get through. And sometimes a follow-up session will need to be scheduled to make sure that we get through absolutely everything, but much of the time we're able to get through it in that first hour and a half. So the types of information that are covered during the assessment. This would be a description of the problem, your symptoms, your reproductive health, your medical history, your diet, your exercise, your sleep habits, your exposure to technology, as well as your spiritual practice if you have one. So all of this information is put together and it is used to be able to determine oftentimes a diagnosis so that we're able to identify exactly what is going on, and that will determine how to treat the problem. And I'll make another video about the need and the use of diagnosis because that can be a very complicated subject matter, but really now is not the time to talk about that in depth. So why do we do this? Why in the world do we need all this information and all this information that takes so long to gather? Well, there's absolutely a rhyme and a reason for it. And that is because sometimes when we're experiencing mental health symptoms, they can mimic biological or medical conditions as well. So for example, if you're experiencing panic attacks, then we want to rule out that you might possibly have heart arrhythmia, or you might have a thyroid problem. So oftentimes I will have clients go to their primary care physician or even the emergency room to be able to get a full workup, get their blood ran, do an EKG if necessary, so that we can rule out any biological conditions that might be contributing to the symptoms that you're having. The last thing that we want is for you to be 2, 3, maybe even 6 months into treatment, still having these panic attacks, not having any sort of medical workup done, when really the issue was heart arrhythmia, and that would be a completely different set of treatment options and the way that we go about treating it. So trying to save you a whole lot of heartache, a lot of time, a lot of money. So that's the reason why we get all that information up front. And another important thing that I want to mention is I also gather information as it pertains to complementary and alternative medicine practices. So this would be things like reflexology, acupuncture, chiropractor, energy healing, Rolfing. If you've never heard of these things, that's okay. But because my approach is integrative, because it is holistic, I also put a focus on the complementary and alternative techniques. And if you're not familiar with complementary and alternative techniques, basically they are just ways to go about treating health that are either in addition to or instead of traditional Western practices. And this is more the wave of the future. More and more doctors are becoming interested in and are supporting the use of complementary and alternative techniques to be able to treat their patients, their clients, what have you. Because we know that just going to the doctor to especially treat mental health symptoms, it oftentimes isn't enough. And if we are a whole person, then it makes sense that we need to be using a variety of different techniques to be able to treat the whole person. So that's essentially phase 1 of the assessment. Phase 2 is a family map. And this is the best way for me to get to know you from a relational aspect, which basically means who you are, where you come from, to also learn about the relationship dynamics in which you are part and how they might be contributing to the symptoms that you are experiencing. So I'm going to turn the camera around so that you can see an example of a family map. So this is a very generic family map that you can see. You are here. This would be mom and dad, brother, sister, sister's husband, cousins, paternal grandparents, maternal grandparents, as well as aunts, uncles, and cousins. And as you can imagine, not all family maps are this simple. Sometimes family maps can be very complicated, but nonetheless, it is still absolutely necessary to be able to gather this information so that we have a direct and thorough understanding of what's going on and all of the contributing factors to the issues that you're experiencing. So that's about it. The assessment is used to gather information, to be able to put it all together, and then we determine what ideas on what the problem might be, and then also put together some ideas as to how to treat them, and also devise perhaps how long you might be in treatment. So look forward to my next video to talk about how long to anticipate being in treatment. Thanks for participating.